Hi, welcome to the Medicine Diseases channel. If you like to subscribe or like. Today we will explain what Tamsulosin is and what Tamsulosin is used for, its side effects, dosage, warnings, precautions, mode of administration, effects on driving ability, interactions, mechanism of action and contraindications. What is Tamsulosin? Tamsulosin is a selective antagonist of the alpha-1A and alpha-1B adrenoceptors that exerts its greatest effect in the prostate and bladder, where these receptors are most common. It is indicated for the treatment of signs and symptoms of benign prostatic hypertrophy. Other alpha-1 adrenoceptor antagonists developed in the 1980s were less selective and more likely to act on the smooth muscle of blood vessels, resulting in hypotension. Tamsulosin was first approved by the FDA on April 15, 1997. Tamsulosin mechanism of action. It selectively and competitively binds to postsynaptic alpha-1 receptors, particularly alpha-1A and alpha-1D subtypes, producing relaxation of prostate and urethral smooth muscle. Therapeutic indications of Tamsulosin. Lower urinary tract symptoms associated with benign prostatic hyperplasia. Pathology of Tamsulosin. Oral route. Adults. Modified or extended release capsules, 0.4 mg/day, after breakfast or first meal of a day. Prolonged release tablets, 0.4 mg/day, regardless of meals. Mode of administration of Tamsulosin, oral route. Modified release hard capsule, administer after breakfast or the first meal of a day. It should be taken whole, with a glass of water while sitting or standing, not lying down. It should not be broken or chewed. Prolonged release tablet, administer independently of meals. It should be swallowed whole and should not be broken or chewed. Tamsulosin contraindications. Hypersensitivity to Tamsulosin hydrochloride, including drug-induced angioedema. History of orthostatic hypotension. Severe liver failure. Warnings and precautions with Tamsulosin. Severe renal failure. Periodic screening, control of rectal examination and determination of prostate-specific antigen. Risk of orthostatic hypotension. Risk of intraoperative flaccid iris syndrome during cataract and glaucoma surgery. Stop treatment in 1 or 2 weeks prior to surgery. Do not administer in combination with potent CYP3A4 inhibitors in patients with slow metabolizing phenotype of CYP2D6. Warnings and precautions in combination with potent and moderate CYP3A4 inhibitors. Do not administer to children under 18 years of age. Liver failure and Tamsulosin. Contraindicated in severe liver failure. Renal failure and Tamsulosin. Caution in severe renal failure, lack of studies. Tamsulosin interactions. Plasma levels, increased by cimetidine, decreased by furosemide. Speed of elimination increased by diclofenac and warfarin. Risk of hypotension with other alpha-1 adrenergic antagonists. Pregnancy and Tamsulosin. Not applicable, only administered to male patients. Effects on driving ability of Tamsulosin. No studies have been conducted on the ability to drive and use machines. However, patients should be aware of possible dizziness. Adverse reactions and side effects of Tamsulosin. Dizziness. Disorders of ejaculation, including retrograde ejaculation and ejaculatory failure.